So while most U.S. households are food secure, a minority of U.S. households experience food insecurity. And it can happen maybe just once or different times during the year, meaning that they have the access to adequate food for active, healthy living is limited by the lack of money and other resources. Some experience very low food insecurity or a more severe range of food insecurity where food is not available to one or more of the family members or their normal eating patterns are disrupted. The U.S. Department of Agriculture, USDA, defines it as a lack of access at times to enough food for active, healthy living. In addition, there is two other subcategories: low food insecurity, which is reduced quality, variety, or desirability of the food, and there may be a little or no indication that there's reduced food intake. Then there's very low food insecurity, and that's where there's multiple indications of disrupted eating patterns and reduced food intake. It is associated with numerous adverse social and health outcomes, and increasingly is considered a critical public health issue. So what are eating dietary patterns? You'll see either one. It is the quantities, proportions, variety, a combination of different foods, drinks, and nutrients in diets, and the frequency in which they are individually consumed. We probably should be looking more at patterns than just saying this is the diet the person's on. But what are their patterns? And why should we be concerned about that? We all eat a certain way. In the morning, I have to have my cup of coffee, and then I have a yogurt. So we have our patterns of eating throughout the day. And so when we look at patterns, those can be disrupted by food insecurity. When we look at CKD and dietary patterns, it's one of the most modifiable risk factors for adverse health outcomes. We know that what we eat affects our cardiovascular system. However, the pathophysiology that's related to the development of CKD is really not completely understood because of the lack of research. And that lack of research has actually contributed to the prevention strategies being underused and often neglected. The American diet is filled with salt, high-fat food, and we know from the evidence so far supports that it is associated with CKD. Food insecurity affects all throughout the United States. However, food insecure rates are highest for single mother households and households with incomes below the poverty level. Food insecure households include those with low food insecurity and very low food insecurity. And the rates of food insecurity are substantially higher than the national average in those single parent households and for Black and Hispanic households. Food insecurity is very common in rural and in urban areas, and not so much in the suburbia. You can see by this number that there are quite a few what we know are food insecure, probably more we don't know. And in 2021, almost 90% throughout the year, these people had some food insecurity. About 10.2% of households were food insecure at least sometime during that year. And then this includes 3.8%, which is about 5.1 million households that had very low food insecurity. And it really hasn't changed since 2020. Food insecurity, as I said earlier, can be temporary, can be long-term. It may be influenced by many factors that you probably already could consider. Some like income, unemployment, or employment, race, ethnicity, and disability. The risk for food insecurity increases when there's not enough money to buy the food or it's not available for them to eat. In 2020, 26% of low-income households were food insecure compared to the national average of 10.5%. I thought she's so precious, and so I thought this was a good representation of where we are with health disparities. So when we talk about health disparities, it's not just race and ethnicity. It is also women in single households. It is people who have disability. It is seniors. It is LGBTQ. We are many people in this United States experience health disparities and experience food insecurity. I tell the students when we go to Guatemala that you think it's bad here. The unfortunate part is there are areas that are just the same or worse in the United States. So we need to think about those areas and how we look at those health disparities. When we look in Black communities, we see that they face hunger at a higher rate than any other communities. And the USDA in 2021 reported 20% of Black individuals live in a food insecure household. They are 3 times more likely to face hunger than white individuals, and Black children are more likely to face hunger than other races. And so if we look even at the poverty level, and we can see in Black communities almost 20%, while in white communities it's about 8%. Latino in 2021, we had 17% Latinos were food insecure. That's 1 in 6, 2.5 times more likely to experience food insecurity than white individuals. And look at the number for the children. And that's why I put the little girl, because we really need to think of these families and these children and the outcomes. And in Black neighborhoods and Hispanic neighborhoods, we see that their conditions may be affected by their access to food. For example, living in a rural area also can affect that. And when there's low-income areas, they may be limited to a full-service supermarkets or grocery stores. This occurs, as I said just a minute ago, predominantly in Black and Hispanic neighborhoods, are more likely to have these food deserts. Convenience stores, we know that they have higher prices, lower quality of food, and less variety of food for people to eat. And about 1 in 5 Native Americans are food insecure. This is in 2021 data. 26% are within 1 mile of a supermarket, and that's compared to 59% of all people living in the U.S. It really makes it difficult for them to get the food that they need. Each Asian community, just like any Black community, any Hispanic community, all unique differences. So the harmful racial stereotypes really cause many to overlook hunger among Asian American and Pacific Islanders, which have about 6% that we know of food insecurity. And these are some of the breakdown from what we know. And this is data that you think about, well, there's like Asian, we look Filipino, 11%. Why is that? Could be because we have more Filipinos that completed. I don't know. So there are many reasons for this data, but just to give you an idea that it is not exempt from one group to the other. And even sadder, we have not only children, but we have seniors. That about 5.5 million seniors faced hunger in 2021. It is really scary that it is about 1 in 6 that have food insecurity and 1 in 14 have hunger. It affects their health, leads to depression, leads to other health problems such as diabetes. Some that are more likely, once again, are Black, Latino, Native American, or those, once again, with lower incomes. We can't forget about public transportation or transportation. So you have to get to the food. So if you don't have access to these places and there are long distance between these, how are you going to get to these supermarkets? And when you do get to these supermarkets, are they quality food? I go to an area in the Glades, which is a rural area in West Palm Beach, Florida, and they have a Winn-Dixie there, which now I guess they're going to be an Aldi, I think. But anyway, they sell to the community. The community doesn't have access to other foods, healthy foods and that. So they buy at Winn-Dixie or that grocery store, and they don't necessarily have the best foods there for them to eat because they're going to cater to the customer and have those foods they want. So really you have to think about what is available, even if they have a major grocery store. They are really in risk for food insecurity when we have the transportation options are limited. The travel to the store the distance is greater, and when there is fewer quality, as I said before, supermarkets or grocery stores. Lack of access to public transportation or personal vehicle limits access to food. Even if we look in a city of Detroit or a big city, an urban area, there is still issues about food insecurity. What about those people who have chronic disease and can't get out of their house? What about the people that have disabilities and may not have access to get to the grocery store? In these areas, we see a high number of food insecurity. A study in Detroit found that people living in low-income, predominantly Black neighborhoods travel on average of 1.1 miles further to the closest supermarket than other people living in a predominantly white, low-income, predominantly white neighborhood.